Okay, let's jump right in. Because I think we've all had this feeling, you know the one, you walk out of a doctor's office or any kind of
Yeah.
health check really, and they give you the all clear. Thumbs up.
Oh, absolutely. It's a feeling of just immense relief. It's almost primal, isn't it?
It is. It's total relief.
Yeah.
It's this moment of validation. You walk out, into the sunshine, you take this big, deep breath, and you think, okay, I'm good.
Right.
I'm bulletproof.
Right.
I can eat that cheeseburger tonight. I can skip the gym because the person in the white coat just said, I'm fine. It's like this huge weight is just gone.
It's the I'm not going to die today badge.
Yes.
That's exactly it.
And we crave that. We're wired to seek out that validation, that reassurance. We want to be told that the machinery is working perfectly so we can just stop worrying about the incredible fragility of our own bodies for a little while.
But, and this is where today's deep dive gets really interesting and, to be honest, a little bit terrifying. What if that feeling of safety is just a complete illusion?
What if the person who gave you that thumbs up, who gave you that relief, what if they weren't even looking at the right thing? What if they were admiring the shiny paint job on your car while the engine was, like, literally on fire?
That is the absolute central tension of the source material we're looking at today. It's exactly that. It's this terrifying gap between feeling fine or even being told you're fine and the reality of being fine.
It's the dissonance.
It's a massive dissonance between your perception and what's actually happening on a biological level.
So today, we are diving deep into a set of materials called the Specialist Maze, Navigating Proper Eye Care. And we're going to be focusing on one part in particular, episode 12, the maze. And I have to say, the maze is just the perfect title for this.
It's so appropriate because the medical system, and maybe especially when it comes to something as specialized as eye care, it's not a straight line. It's not intuitive at all. It's a labyrinth. And if you take a wrong turn in that labyrinth, you don't just, get a little lost and have to ask for directions. You can lose something absolutely vital. You can lose your sight.
Which is, that's a terrifying thought. So our mission today is to really decode this whole hierarchy. We want to figure out who is who in this maze, because the source makes it painfully clear that we as patients, we often trust the wrong people with our health.
Oh, we do.
And it's for a simple reason.
Mm-hmm.
We don't understand the titles on their name tags. We see a white coat or, even just a nice professional-looking clinic, and we just assume doctor. We assume expert. We assume they know everything there is to know.
And that assumption can be incredibly dangerous. The stakes here, they couldn't be higher. We're talking about vision. We're talking about preventing blindness. So the goal of this deep dive really is to arm you, the listener, with the knowledge to make sure you never end up in the position of the main character from our source material.
Right. The character they call Confused Carla. I really want to start there with her story. Because when I read this narrative, it hit me so hard. It felt so incredibly normal.
It's a very relatable scenario.
It is. It felt like something I've done, a dozen times in my life. It didn't feel like a horror story at all, not until the very, very end.
It's a tragedy that begins as something completely mundane.
Exactly.
Yeah.
So let's set the scene here. The story of Confused Carla. Carla needs new glasses. Okay, we've all been there. Your prescription is a little off. Things are getting blurry. So she goes to the mall.
The mall.
Yeah.
The great American crossroads of commerce and, apparently, healthcare.
Right. So she walks into one of those optical shops. You know the ones I'm talking about. They're always super bright with these rows and rows of shiny frames on the wall. It smells like, I don't know, Windex and commerce.
And maybe a faint whiff of pretzels from the food court.
Totally. It's a standard retail environment. It's designed from the ground up to be comfortable, to be inviting, to be as low stress as possible.
Which is the opposite of most medical environments.
100%. And so she meets this nice person. That's the specific phrase the source uses. The nice person at the shop. And this person, they do an exam. Carla sits in the big chair. She looks at the chart on the wall. She reads the letters, EFPTOZ.
The classic routine.
And at the end of it all, the verdict comes down. The nice person gives her this big smile, and it's probably a genuine friendly smile, and says, Carla, great news. You see 20/20. Your eyes are healthy.
And that is the precise moment of reassurance. That is the all clear we were talking about. And it is the exact moment the trap snaps shut.
And Carla is, of course, thrilled. She's relieved. She probably buys some cute new frames. She leaves the shop happy, feeling good. She goes about her life thinking she has checked that box off her to-do list.
Yep. Eye health. done. She probably tells her family, her friends, oh yeah, I went to the eye doctor, everything's perfect. I've got 20/20 vision.
But this is where the source material just yanks the rug out from under you. The narrative jumps forward.
And it's not a big jump.
No. 6 months. Just 6 months later, Carla suffers a massive bleed in her eye.
A massive bleed. And we need to be clear about what that means. This isn't just, seeing a few more floaters or your vision getting a bit blurry. This is a catastrophic event inside the eye. A vitreous hemorrhage. It's like a curtain coming down. The lights just go out.
And the emotional fallout that the source describes is just heartbreaking. She feels completely and utterly betrayed. She's screaming, "They told me I was fine. They just told me my eyes were healthy. I was just there."
That feeling of betrayal is the absolute crux of this whole issue. She feels like she was lied to. She feels like the system fundamentally failed her.
And it did, in a way.
It did, but if we look really closely at what the source is saying, the tragedy isn't that someone lied to her maliciously. The tragedy is that she was asking the wrong questions to the entirely wrong person.
Okay, so let's unpack that. How is this even possible? How can someone see 20/20, which we all think of as perfect vision, right? The gold standard, and then have a massive sight-threatening bleed inside their eye just 6 months down the road? How do those two realities even coexist?
It all comes down to a fundamental misunderstanding of who she was seeing. The source material puts it so bluntly, it's almost brutal, it says. She went to the wrong mechanic.
The wrong case.
She saw an optician when what she desperately needed was a retina specialist.
And that distinction between an optician and a retina specialist is, as the source implies, the difference between, say, buying a new pair of shoes and having open-heart surgery. But to Carla, and let's be honest, to most of us, it all just looks like eye care.
Precisely. It's all under one big, confusing umbrella. And that is why we have to start by dismantling this whole concept of the mall exam.
Yeah.
We need to take apart the assumptions that led Carla straight into that moment of betrayal and terror.
Okay, let's do that. Section 1, the trap of 20/20 vision. The source states, very explicitly, the mall exam is not enough. But that goes against everything we're taught, right? Since you're in kindergarten, the school nurse puts you in front of that chart. You cover one eye with that little plastic spoon thing.
Cheek occluder, yeah.
And you read the line. If you can read the 20/20 line, you pass. You're healthy. You get a sticker.
And that is the great misconception. It's a dangerous one. We, as a society, have conflated visual acuity, which is all that 20/20 measures, with biological health. And they are absolutely not the same thing.
So they're two different concepts entirely.
Completely different. You can have perfect 20/20 vision and have a malignant tumor growing in the back of your eye. You can have 20/20 vision and have diabetic retinopathy that is, a ticking time bomb on the verge of bursting.
Whoa, okay, hang on. Let's pause on that for a sec because that's a huge revelation for me. So you're saying 20/20 is literally just a performance metric. It's like saying, can the camera lens focus properly right now? Not, is the camera's internal wiring about to short circuit and explode?
That is a fantastic way to put it, yes. Or 20/20 just means that the optical system of your eye, primarily your cornea and your lens, is focusing light correctly onto the retina at this very moment. It tells you absolutely nothing about the structural integrity of the retina itself.
Or the blood vessels.
Nothing. Or the optic nerve, or the pressure inside the eye. It's a functional test, not a pathological scan. Carla's function was fine. Her pathology was a disaster waiting to happen.
That is genuinely terrifying. It's like a mechanic saying, well, the car can drive at 60 miles per hour, so the brake lines must be fine. Yeah. It's a total non sequitur. Those are two completely different systems.
Exactly. And let's talk about the nice person at the shop. The source really emphasizes that they were nice. Why do you think that matters so much in the narrative?
Yeah, why do they keep harping on the niceness? It seems like a weird detail to focus on.
It matters because in a retail setting, we are psychologically primed to equate good customer service with good medical care. It's a cognitive shortcut. If the person is friendly, if they're efficient, if they help us pick out frames that look good on our face,
You start to trust them.
you subconsciously grant them authority over your health. You think, wow, they were so helpful and nice. Surely they would have told me if I was in danger of going blind.
The halo effect, right?
Yeah.
They're nice, so they must be competent. They're nice, so they must have been thorough.
But here's the kicker. They couldn't have told her.
What do you mean they couldn't?
They literally couldn't have known. And that is why the source calls the system a maze. It's not about malice. The optician at the mall wasn't trying to hurt Carla. They were doing their job. But Carla was navigating a system she didn't understand. She thought she was getting a medical clearance.
But she was actually just completing a retail transaction.
That's it. She bought a product. She didn't get a diagnosis.
She bought vision correction. She did not buy eye health assurance.
You've nailed it. And that is the distinction that can save your sight.
Wow. Okay, so this leads us directly into the hierarchy. We have to understand the players on the field here. Because if we don't know who's who, we're flying blind. The source breaks this all down using a really specific and I think very helpful analogy.
The mechanic analogy.
The mechanic analogy.
I love this analogy. It's so good because it strips away all the confusing Latin names and the medical jargon, and it just puts it in terms that anyone who has ever owned a car can immediately understand.
Okay, so there are 4 levels here. We're going to climb the ladder of specialization. Let's start at the bottom. Level 1, the optician.
Right.
The source defines them as the salesperson who fits glasses frames. And the analogy they use is the tire shop.
The tire shop. It's perfect. Think about what a tire shop does. You go there when you need new tires, or you need your tires rotated, or maybe you want some fancy new rims.
Yeah.
It is an essential service.
Absolutely. You can't drive a car without tires. If your tires are bald, you are in danger.
It's a safety issue, so the tire shop is important.
Right. I go to the tire shop. I like getting new tires. Makes the car ride smoother.
But, and this is the absolute key to the whole analogy, if your engine starts making a strange knocking sound, like a deep rhythmic thud coming from under the hood, do you go to the tire shop for that?
No, of course not. I mean, I guess I could ask the guy who's changing my tires, hey man, do you hear that weird knocking noise?
And what would he say? What's the best case scenario there?
He'd probably just shrug and say, I don't know, man, I just do tires. But hey, your treads look great. Or maybe he'd listen for a second and say, sounds okay to me, because he doesn't know what he's listening for.
Exactly. The optician, the tire shop, can tell you that your tires are fine. In Carla's case, that means your glasses fit well, or that your new prescription lets you read the 20/20 line on the chart. But they literally cannot look under the hood.
They can't.
They are not trained for it, they are not equipped for it, and in most places, they are not legally allowed to diagnose what is happening inside the engine.
So Carla went to the tire shop. She got a fantastic set of new tires. She had 20/20 vision. But her engine was about to seize up and explode.
Precisely. She was looking for comprehensive engine repair in a tire showroom. And because the showroom was clean and the staff was friendly, she felt safe and reassured.
That is such a harsh but necessary reality check.
Yeah.
Okay, so that's level 1. That's our baseline. Let's move up the ladder. Level 2 is the optometrist. The source calls them the general mechanic.
Now, this is where it gets more nuanced, and it's really important here not to disparage optometrists. They are vastly more qualified than an optician. They are doctors of optometry, ODs. They go to school for a long time. They can check vision. They can check for eye diseases. They can prescribe glasses and even some medications.
So they're kind of like the guy I take my car to for an oil change and a general tune-up. The local shop on the corner that I trust.
Yes, that's a great comparison. They are the generalists, the primary care provider for the eye. If you have a standard issue, pink eye, dry eyes, you need a prescription update, maybe a mild infection, they are fantastic. They're the general mechanic. They can spot a lot of things. In fact, they can often be the first to spot that engine trouble.
But the source material still places them as the middle ground.
It does. It places them as the generalist, not the surgeon. They are not the ones who are typically going to be doing the heavy lifting if things go really, really wrong with the engine itself.
They're more like the gatekeepers then.
Often, yes. They are the ones who are supposed to say, hey, I hear a definite knock in that engine, and I can't fix that specific problem here. You need to go see the specialist. But, and this is a big but, if you are in a mall setting, sometimes that line can get a little blurred. Sometimes the retail pressure to sell glasses can overlay the medical necessity of a referral.
Right. Which brings us to level 3, the ophthalmologist. Now we are getting into the really heavy hitters. The force defines them as the medical doctor who performs surgery. And the analogy shifts here. It shifts from mechanic to engineer.
And that word choice is very deliberate. An engineer understands the entire system from the ground up, from first principles. An ophthalmologist is an MD or a DO. They have gone to 4 years of medical school. They've done a grueling internship. They've done a multi-year residency in eye surgery. They're trained to cut the eye open and put it back together.
So if the optometrist is the guy changing your oil and checking your fluids, the ophthalmologist is the one who can actually take the engine completely apart on a workbench and rebuild it from scratch.
Yes. This is where surgery happens. Cataract surgery, most glaucoma surgeries, corneal transplants, things of that nature. This represents a profound shift in expertise and capability. You are moving from what is essentially maintenance to major structural repair.
It's the difference between keeping the car running day to day and actually rebuilding the car after a crash.
A perfect analogy. If you need a new transmission, you don't go to the quick lube place. You go to the specialist transmission shop. You go to the engineer.
But the source says even that wasn't enough for Carla's specific problem, was it? Because there's one more level. There's a level 4, the retina specialist.
The absolute top of the pyramid. The source calls them the super specialist for the back of the eye.
And the final analogy is the engine specialist.
So think about it. If you have a very specific, high-performance, complex problem that's happening deep inside the workings of the machine, you don't just want a general engineer. You want the person who has dedicated their entire professional life to that one specific critical component.
The person who only works on fuel injectors for Formula One cars.
Exactly. The retina is the neural tissue that lines the back of the eye. It is unbelievably complex. It is, for all intents and purposes, brain tissue.
Wait, really? The retina is actually brain tissue? I always just thought it was, I don't know, like a kind of light-sensitive skin or part of the lens.
No. Embryologically, the retina and the optic nerve grow out from the developing brain. It is central nervous system tissue that has been pushed forward to the front of the body to detect light. It's an extension of the brain. It's the film in the camera, but it's living, breathing, bloodthirsty tissue.
Bloodthirsty.
It has one of the highest metabolic rates in the entire body. It consumes more oxygen by weight than almost any other tissue. It is incredibly demanding.
Wow, so it's a very high-maintenance piece of equipment.
Extremely. And so when things go wrong back there, like a bleed, a detachment, macular degeneration, you need the highest possible level of specialization. You need someone who lives and breathes the neurocircuitry and the incredibly fragile vascular system of the retina.
And this
Yeah.
is who Carla needed. She
Yeah.
had a massive bleed in the back of her eye. That is a deep, specific engine problem.
Correct. A catastrophic engine failure. And she was at the tire shop getting her hubcaps polished.
God, when you put it that way, it is absolutely terrifying. It's like having a heart attack and going to a shoe store because, they both deal with things that help you walk.
That is a very apt, if slightly absurd, analogy, but yes.
Oh.
The chasm of expertise between an optician and a retina specialist is that vast. One deals with the external passive equipment, the glasses, the shoes, and the other deals with the life or death internal biology, the retina, the heart.
Okay, I want to dig even deeper into this central metaphor that the source uses. Section 3 in our outline is all about the Ferrari analogy. The quote is just so perfect. If your Ferrari engine is making a noise, you don't go to the tire shop.
It's such a powerful, immediate image.
So my question is, why a Ferrari? Why not a Honda Civic or a Ford F-150? What is the source trying to communicate by picking that specific car?
I think it speaks directly to the complexity, the performance, and the delicacy of the human eye. The eye is an absolute marvel of biological engineering. It's incredibly high performance. It's exquisitely sensitive. It is not a tractor. You can bang on a tractor engine with a wrench, and it might start working again. You cannot do that with a Ferrari, and you certainly cannot do that with a human eye.
It's high stakes. It's unforgiving. You don't just let any old mechanic mess around with a Ferrari engine. One wrong move, and it's a $100,000 mistake. It's totaled.
Exactly. And let's talk about the noise that the source mentions. If the engine is making a noise. Now, in Carla's case, maybe she didn't hear a noise yet. Maybe her symptom was silence. But the potential for catastrophic failure was there, building up under the surface.
That's the scariest part about the phrase massive bleed, which is what the story says happened. It sounds like it just came out of absolutely nowhere.
And often from the patient's perspective, these things do, or rather the damage accumulates silently, without any symptoms, until it reaches a tipping point and becomes catastrophic. This is precisely why the reassurance from the tire shop is so incredibly dangerous.
Because it makes you ignore the problem you don't even know you have.
Yes. The source has another killer quote here. It says, "The tire shop will tell you the tires are fine, but they won't even open the hood."
They won't even open the hood. That is the phrase that just stuck in my brain. What does opening the hood represent in the real world in this context?
This is probably the single most critical, actionable piece of technical detail in the entire source material. Opening the hood is the dilated exam.
Dilation. Okay, I have to be honest. I hate dilation. The drops sting. My vision gets all blurry for hours. You look like a demon in photos because your pupils are massive. I avoid it whenever I can.
Almost everyone does. It
Yeah.
is inconvenient. There's no question about it. It stings for a second. You can't read your phone easily for a few hours. It's annoying. But without it, the doctor is looking at your engine through the keyhole of the car door.
Through the keyhole. What does that mean?
Well, think about your pupil. The pupil is just a hole in the middle of your iris, the colored part of your eye. When you shine a bright light into someone's eye, which you have to do to be able to see inside, what does the pupil naturally do?
It shrinks. It constricts down to a pinpoint.
Exactly. It clamps down to protect the sensitive retina from the bright light. So the doctor's trying to look deep inside this dark room, but the doorway they're looking through is actively getting smaller and smaller the moment they try to look. Without dilation drops, they can see maybe 15% of the retina?
Only 15%.
At best, they can see the very central part, the optic nerve head, maybe the macula if you hold really, really still, but the periphery. The outer edges of the retina, where things like tears and detachments often start. The rest of the engine, it is completely hidden in the shadows.
So if I go into an exam and I say no thanks on the dilation, I have to drive home soon, I am basically telling the mechanic, go ahead and check my engine, but you have to keep the hood closed and locked.
That is exactly what you're doing. You are asking them to guess. You are asking them to assume the entire engine is fine because the car is idling okay in the parking lot. And the optician, the tire shop, they literally cannot open the hood. They don't have the diagnostic drops. They don't have the training to interpret what they'd see. They are looking at the hubcaps,
And confidently telling you the car is in perfect condition.
while the engine is quietly smoking and about to burst into flames.
That is chilling. It completely reframes that whole experience for me. It makes me realize how many times I've settled for the hubcap check and walked out feeling responsible, feeling like I was being a good adult and taking care of myself.
It is the illusion of health. It feels good, but it's not real. And that is what we are trying to shatter today. We want you, the listener, to become uncomfortable with that illusion so that you can seek out the reality, even if it's a little more inconvenient.
So we've established the trap of 20/20 vision. We've laid out the hierarchy of specialists. Now let's talk about who is most at risk here. Section 4 in our notes. The critical why, the diabetic connection. The source material has a very specific, actionable takeaway that's aimed at a particular group of people.
Yes. And while this advice about knowing your specialist really applies to everyone, I mean, anyone can have a retinal tear or a tumor or glaucoma, the source specifically flags people with diabetes as being in the highest risk category.
Why diabetes specifically? The source mentions Carla had a massive bleed. Is that directly connected to diabetes?
It is. Although the source uses Carla as more of a narrative vehicle for a general warning, a massive bleed like the one described is the absolute hallmark complication of advanced diabetic retinopathy. It is the classic presentation of untreated or poorly treated diabetic eye disease.
Can you explain that mechanism for us? Like, why does having high sugar in my blood make my eye bleed? That seems like such a weird, disconnected cause and effect.
It's a great question. It all comes down to vascular integrity, the health of your blood vessels. Over time, high blood sugar is essentially toxic to the delicate inner lining of blood vessels all throughout your body. It makes them weak, it makes them brittle, it makes them leaky.
Okay.
But the tiny, microscopic, delicate blood vessels in the retina, the ones responsible for feeding that high metabolism brain tissue we talked about, they are particularly vulnerable.
They're the weak link in the chain.
They are the canary in the coal mine for your entire vascular system. When those retinal vessels get damaged by high sugar, a couple of bad things happen. First, they start to leak fluid and blood into the retina, which causes swelling and blurry vision. That's called macular edema.
And the second thing.
The second thing is that parts of the retina start to starve for oxygen because the pipes delivering the fuel are broken. So the eye, in a desperate attempt to fix this, tries to save itself. It grows new blood vessels.
Well, that sounds like a good thing. The body is trying to heal itself. New vessels, new supply lines.
It sounds good, but it is an absolute disaster. These new vessels, the medical term is neovascularization, are cheap, shoddy emergency construction. They are incredibly fragile. They grow in the wrong places, like into the vitreous jelly in the middle of the eye. And with the slightest provocation, a cough, a sneeze, or just spontaneously, they burst.
And when they burst?
Massive bleed. The entire vitreous cavity fills with blood. Vision goes from blurry to black in an instant. That is almost certainly what happened to Carla.
So if you have diabetes, your Ferrari engine is under constant, unrelenting stress. You are basically redlining it every single day.
Yes, you are driving that Ferrari hard through a field of potholes every single day. The risk of a catastrophic breakdown is exponentially higher than it is for the general population.
So given that high risk, the source gives a very specific, very clear prescription. It says, and I'm quoting here, if you have diabetes, ask for a dilated fundus exam with an ophthalmologist or retina specialist at least once a year.
And every single word in that sentence matters. It's incredibly dense with crucial information. We should break it down.
Okay, let's do it. First part, dilated fundus exam. We've talked a lot about dilated. That means opening the hood. What is fundus? It sounds like a kind of mushroom, or maybe a fun place to be.
It's neither of those, unfortunately. The fundus is simply the medical term for the interior surface of the back of the eye. That's the whole landscape back there. The retina, the macula, the optic disc, the fovea, all of it. So a dilated fundus exam translates directly to open the hood wide and perform a thorough inspection of the entire back of the engine.
Got it. Okay. And the source is very specific about who needs to do this and send ophthalmologist or retina specialist.
Notice who is conspicuously missing from that list.
The optician.
A tire shop.
And in this specific high-risk case, even the optometrist is sidelined. The source is saying, for this particular problem, you need to go directly to the engineer, or better yet, the engine specialist. Do not stop at the tire shop. Do not even stop at the general mechanic if you have this specific high-risk condition.
But why bypass the optometrist? You said they can dilate eyes, right? They can, absolutely. And many optometrists are very, very good at spotting and managing diabetic retinopathy. But the source here is advocating for the absolute highest level of safety, the gold standard. If you have diabetes, the pathology can be incredibly subtle and then suddenly catastrophic.
So it's about pattern recognition.
It's entirely about pattern recognition. An ophthalmologist, and especially a retina specialist, looks at diabetic retinas all day, every single day. Their brain is tuned to spot the tiniest, most subtle changes that signal that the Ferrari engine is about to fail. They see things that a generalist might miss.
And the frequency they recommend, at least once a year.
That's the minimum, because things can change so fast. Remember, Carla was fine, and then just 6 months later, she wasn't.
That neovascularization, those bad new blood vessels, can grow relatively quickly. If you catch them early, you can treat them with a laser or with injections into the eye. You can prevent the bleed, you can save the sight.
But if you wait for the bleed to happen,
It is much, much harder to fix. The horse has already left the barn. The warning in the source is just so blunt. It says the mall exam is not enough. It feels like. It feels like a warning label on a pack of cigarettes. It's that stark.
it has to be. Because the convenience of the mall exam is so seductive, it's easy, it's fast. You can get a pretzel and some new shoes right afterwards. It fits into our busy lives. But if you have diabetes, relying on that convenience can, and I'm not being dramatic here, it can cost you your sight.
It all just circles right back to Carla's tragedy, doesn't it? She's substituted a medical exam with a retail transaction. In her mind, she thought, I went to the eye place.
And the eye place failed her. Not because the people there were evil or incompetent at their jobs, but because they were fundamentally limited. They did what they were designed to do, sell glasses. Carla desperately needed what they were not designed to do, save her retina.
So if I'm listening to this right now and I'm having that sinking feeling of, oh my God, I'm Carla. I just went to the mall optical shop last month and I have diabetes. Or maybe I haven't had my eyes dilated in 5 years. What should I do? What's the immediate next step?
You need to become an advocate for your own health, right now. You need to check the credentials of the person you are seeing. Are they an optician, an optometrist, an ophthalmologist? And most importantly, when they examined you, did they dilate your eyes? Did they open the hood? If the answer is no, you need to make an appointment with an ophthalmologist immediately.
It really is all about being an informed consumer of your own health care. It's about not being a passive recipient of whatever the system decides to give you.
It's about survival. That sounds dramatic, but it's true. In the maze of the modern medical system, knowing the difference between a salesperson and a surgeon is the only map you have. You cannot just rely on the system to automatically guide you to the right place. The system will often guide you to the most profitable outcome or the most convenient outcome. You have to be the one to guide yourself to the safest outcome.
That is such a powerful thought. The only map you have is your own knowledge.
Let's summarize the maze one last time just to really lock it in for everyone. Level 1, the tire shop, is the optician. They're great for frames and fitting glasses, but they are useless for diagnosing disease.
Level 2, the general mechanic, is the optometrist. Good for general eye health, checkups, prescriptions. They are your first line of defense.
Level 3, the engineer, is the ophthalmologist. This is your surgeon. This is who does the major repairs.
And level 4, the engine specialist, is the retina specialist. This is the super subspecialist you absolutely need when the check engine light for your retina starts flashing red.
And the core takeaway is that your eye health is not just about whether you can see 20/20.
No.
No, that's just one small piece of the puzzle. Real health is about the integrity of the engine. It's about what's happening behind the curtain under the hood. Visual acuity is just the shiny paint job.
Wow. I am honestly never going to look at an eye chart the same way again. It's almost like the eye chart is a form of misdirection. Look over here at these pretty letters. Don't worry about the fragile blood vessels that are exploding in the back.
It absolutely can be a dangerous distraction if that is where the exam begins and ends. The letters on the chart are the start of the conversation, not the end of it. The letters are the hello. The dilated exam is the deep, meaningful conversation.
This has been incredibly eye-opening. Sorry, I can't help myself. The pun is just sitting there. But seriously, this changes the way I think about responsibility. We have this tendency to outsource our responsibility for our health to these professionals, but we have to make damn sure we're outsourcing it to the right professional for the job.
Precisely. Trust but verify. And know who you're talking to. Don't ask a plumber for sock tips, and don't ask a tire salesman about the health of your brain tissue.
So I guess here is my final question for you and for everyone listening at home. The source material asks us to check our own assumptions, so I'll ask it directly. When was the last time you let a tire shop tell you your engine was fine?
Oh.
And not just with your eyes, with any part of your health.
That is the provocative question, isn't it? Because we do it all the time in all sorts of ways. We take the path of least resistance. We ask a banker for tax advice instead of a CPA. We ask a fitness influencer on social media for nutrition advice instead of a registered dietitian. And we ask an optician about our retinal health.
We do. We want the easy answer. We want the nice person to pat us on the head and tell us we're okay. It just feels better. But maybe, just maybe, what we really need is the engine specialist to get in there and take a hard look, even if it's inconvenient. Even if we have to wear those goofy-looking sunglasses for a few hours afterwards.
The inconvenience of a dilated eye exam is absolutely nothing when you compare it to the life-altering tragedy of preventable blindness. A few hours of blurry vision versus a potential lifetime of darkness. The math on that is very, very simple.
Amen to that. Listeners, look at your receipts from your last eye exam. Look at the name tags in the office. Don't be confused, Carla. Be, I don't know, informed, Ivan.
Let's maybe workshop the nickname a little bit.
Yeah, we'll work on it. Maybe dilated, Dave. No, that sounds weird.
Yeah.
But you get the point. Learn to navigate the maze, find the right mechanic, take care of your Ferrari.
And for God's sake, let him open the hood.
Thanks for diving deep with us today. We'll see you next time.
Goodbye, everyone.